Right, guys. So, very good evening to all of you. So, we people have come here for this pharmacology important important topic discussion. Yes, I can see many students are online right now. So, I hope you people can watch me on this YouTube link. Yes, Dr. Simran, I can read your message. Yes, so Dr. Simran, good evening. Dr. Anand, yes. So I can see your chat, guys. Whatever you will type, I can see. And in case you people have any doubt, you people have any major issues, you can uh, put it over here in the chat box. So I'll try to reply your queries as much as possible during this short session. Although we already have a like extended session, the stretched out session of pharmacology revision. That's a face-to-face live class. Yes. So Dr. Max, Dr. Patel, Dr. Rohit, Dr. Abhinandan. I hope everyone is doing good over here. So let's start with this uh, revision session where I have planned to discuss some important topics with you. Like I'll try to cover all the important topics in this session of approximately 120 minutes or maximum 150 minutes, right? So the session will last for 2 hours or maybe 2.5 hours, not beyond that, because even you people have limitation to sit up till 11:30 onwards, right? Difficult to sit. Yes. So yes, Dr. Abhinandan, okay, yes, Abhinandan has mentioned. Abhinandan is a student from, I think, Tamil Nadu. Yes, Abhinandan, I can recognize you. You are the one for that who is from Tamil Nadu, right? Abhinandan? Yes, yes. Good evening, Dr. Avya, Dr. Patel. Yes, okay. So we have a session of 2.5 hours, okay? Maximum 2.5 hours, minimum 2 hours. So starting with the first topic, that is antimicrobials. So starting with first topic, that is antimicrobial drugs. So antimicrobials, I have seen like maximum questions are asked from TB drugs. So maximum questions have been asked from TB drugs. So this is one of the very important topic. So like if the question is asked to you, which medicines are first line TB drugs? So that you people already know. We have four first line TB drugs, that is H, R, Z, and E. So these are the four main drugs which are known as first-line TB drugs: isoniazid, rifampicin, pyrazinamide, and ethambutol. Now, you people already know this point that all these medicines are cell wall inhibitors. All these medicines are cell wall inhibitors except rifampicin, which is a RNA polymerase inhibitor. So all medicines are cell wall inhibitor except rifampicin, which is RNA polymerase inhibitor. Second, if we talk about their method of killing the bacteria, so I will say the medicine's pharmacodynamics. So all medicines are bactericidal. All medicines are bactericidal drug except ethambutol, which is bacteriostatic medicine. So ethambutol is the only medicine which is bacteriostatic. The rest of the medicines are bactericidal. Number three, if we discuss some of their important side effects. So what are the important side effects of these medicines? So we have the drugs like isoniazid. This will cause liver dysfunction. Even the rifampicin will cause liver dysfunction. The pyrazinamide can also cause liver dysfunction. So three medicines can cause liver dysfunction, right? But there are two medicines which will cause hyperuricemia also. So ethambutol and pyrazinamide are two medicines that will also cause hyperuricemia. Now, apart from that, this isoniazid is a drug that will also cause vitamin B6 deficiency. And this vitamin B6 deficiency can result in important side effect as peripheral neuropathy. One more side effect is this medicine can result in SLE-like symptoms. Now, as a result of SLE-like symptoms, the patient can present it to you with symptoms like arthritis and vasculitis. So, patient symptoms can be arthritis and vasculitis. Now, rifampicin can cause liver dysfunction. Apart from that, rifampicin can result in flu-like symptoms. So rifampicin can result in common cold-like symptoms. Flu-like means the common cold symptoms, mild fever, mild cough, all these symptoms are there. This will also result in orange discoloration. This will also result in orange discoloration of body secretion. And one of the very important side effect is hypersensitivity reaction. And because of that reason, this medicine can cause bone marrow suppression. So this is the drug that will cause bone marrow suppression like leukopenia and thrombocytopenia. Pyrazinamide, only two side effects, liver dysfunction, hyperuricemia. Ethambutol is a medicine that will cause retinopathy. So this is the drug that will cause retinopathy. This will cause optic neuritis. And as a result of optic neuritis, this medicine can result in red-green color blindness. So this is the medicine that will cause optic neuritis. So ethambutol starts with E. Ethambutol starts with E. This medicine is going to affect your eyes. So very important side effect. Ethambutol is going to affect your eyes. So E is for eyes side effect. The drug name is ethambutol. So these are some important side effects of first line drugs. But I have noticed in the last 5 years, the most questions are asked from the second line drugs. So if we talk about the second line drugs for tuberculosis, these are more important for your exam instead of first line drugs. So we have some bactericidal medicines and we have some bacteriostatic medicines. So we have some bactericidal and then some bacteriostatic medicines. So bactericidal medicines are fluoroquinolones. So fluoroquinolones are the medicines which are DNA gyrase inhibitors. So these are the drugs which are DNA gyrase inhibitors. And by inhibiting DNA gyrase enzyme, these medicines can inhibit the TB bacteria. So two medicines have got approval. One is levofloxacin and the moxifloxacin. So this is about the fluoroquinolone, which are bactericidal medicines. We have aminoglycosides. Now, aminoglycosides are the drugs which are protein synthesis inhibitors. These are the medicines, aminoglycosides, which are protein synthesis inhibitor. But these medicines are always given as injectable. Like these are not the oral medicines. So TB mein oral route is very important route because patient has to take medicine for a long time. But this group has a problem. This is always via injectable route. Number three medicine that is asked frequently in your previous exam is bedaquiline. Now bedaquiline is a medicine. This is a ATP synthase enzyme inhibitor. So this is the medicine that is ATP synthase enzyme inhibitor. The drug name is bedaquiline. It's a bactericidal medicine, ATP synthase enzyme inhibitor. And this drug can lead to an important side effect as QT prolongation. So medicine can result in QT prolongation as a side effect. And this is the medicine that we can try for MDR and the XDR TB treatment. We have one more medicine here. The drug name is pretomanid. So we have a medicine like pretomanid. We have a drug like delamanid. So pretomanid, delamanid are two more medicines which are cell wall inhibitors. So these are the bactericidal medicines, cell wall inhibitor, and their important side effect is also QT prolongation. And mostly these medicines are given for the treatment of XDR TB. So we can use these medicines for the treatment of again XDR TB like pretomanid and the delamanid medicines. So there is one regimen that can be asked in your exam that is known as BPAL regimen. So guys, any idea in this BPAL regimen, which three medicines are the part of this regimen? So this regimen is important that is given for MD or TB. So this can be asked in your exam. So what are the three drugs which belong to this BPAL regimen that you should be knowing? What are the drugs which are bacteriostatic medicines? So we talk about the bacteriostatic medicines. So we have a drug over here. The drug name is linezolid. So linezolid is a medicine that's a protein synthesis inhibitor by acting on 50S ribosome. So this medicine will act on 50S ribosome. This is a protein synthesis inhibitor, linezolid. And the medicine side effects are very important. The medicine side effects you can remember with the mnemonic, that is BSNL. So this is the drug that will cause bone marrow suppression. This is the medicine that will cause serotonin syndrome. So this medicine can result in serotonin syndrome, can result in bone marrow suppression like thrombocytopenia, can result in neuropathy as a side effect, and can result in lactic acidosis. So four important side effects of medicines are lactic acidosis, neuropathy, serotonin syndrome, and the bone marrow suppression, the side effect of linezolid as a medicine. Second medicine, that is a bacteriostatic medicine. The drug name is cycloserine. So cycloserine is one more TB drug that's a cell wall inhibitor. And by inhibiting cell wall, this medicine can inhibit the bacteria. And the important side effect of this medicine is CNS toxicity. So this is the medicine that will cause seizures and psychosis as a side effect. So this medicine can result in seizures and psychosis as a side effect. So can result in CNS toxicity as a side effect. This is a side effect of this medicine, that is a cycloserine. Now after cycloserine, we have a drug ethionamide. So ethionamide is a medicine that's also a cell wall inhibitor. And this medicine important side effect is hypothyroidism. So there are high chances that you will be asked about this side effect of ethionamide, hypothyroidism. This is important for this year exam. And also they can ask you the linezolid mechanism of action. So linezolid mechanism of action can be asked. This beta-quilline is very important drug for your exam. This pretomanid, delamanid, these are also important. And this regimen is very important. So this is something that you people have to understand. You have to remember when you're going for your exam of January 2025. These are the important aspect in TB drugs. Now, apart from this TB drugs, the second topic of antimicrobial is HIV treatment. So HIV treatment is something that is also important for your exam. So the medicines that we use for treatment of HIV, we call them enzyme inhibitors. So medicines that we use for HIV are known as enzyme inhibitors. We have the medicines like NRTIs. So all these medicines end with the word butene. So any medicine that ends with the word butene is NRTI. That's a nucleoside reverse transcriptase inhibitor. We have NNRTIs. So non-nucleoside reverse transcriptase inhibitor. All these medicines end with the word virin. So medicines end with the word virin, that's NNRTI, and NRTIs are butene. Number three, guys, we have a third group of medicine. We call them integrase enzyme inhibitor. So the medicines which are integrase enzyme inhibitor, these medicines end with the word tigrevir. Now we have a fourth medicine, that's a protease enzyme inhibitor. So PI means the protease enzyme inhibitor. All these medicines end with the word navir. So can you people write one example of all these four group of medicines? The medicines which are NRTIs are butene. The medicines which are NNRTIs, they end with the word virin. And we have our medicines that end with the word tigrevir. We call them integrase enzyme inhibitor. And we have our medicines which are protease enzyme inhibitor. We call them, all these medicines end with the word navir. So it's better if you write these four medicines examples in the chat box. Now, whenever we have to treat a patient of HIV, so any HIV positive patient, what is the treatment that we give to a patient? So you can remember with the mnemonic, that is delete. So the short form of delete is DLT. So DLT is a word that you can remember for the treatment of HIV. So here we give three medicine combination. Here we give a combination of dolutegravir, lamivudine, and tenofovir. So tenofovir, lamivudine, and dolutegravir are three medicines. These medicines are the main drugs that we use for HIV. Now, out of these medicines, the tenofovir is a drug that is known as nucleotide reverse transcriptase inhibitor. It's not the nucleoside reverse transcriptase inhibitor. This is a nucleotide reverse transcriptase inhibitor. This is a nucleoside reverse transcriptase inhibitor, NRTIs. And dolutegravir is a medicine that's an integrase enzyme inhibitor. So these three medicines are given together, and these medicines are need to be given lifetime. So medicines need to be given lifetime, right? So one tablet patient will take at night time. So one tablet daily patient will take at night time, and this need to be taken lifetime. Now, whenever the patient is healthy and patient get exposure to some HIV positive patient, like you are a healthy doctor and you get an exposure of a patient blood that is HIV positive patient. So as a doctor, you people have to take post-exposure prophylaxis. Now, same treatment we give for post-exposure prophylaxis. The same treatment we give for post-exposure prophylaxis, but this is given only for 28 days. So immediately you get an exposure, you have to take the same treatment for 28 days. This is post-exposure prophylaxis that is taken in HIV. Now this best to be started. So this is the treatment that is best to be started within 2 hours. But maximum you can start in 72 hours. After 72 hours, there is no rationale of starting the post-exposure prophylaxis, right? So best treatment, best started within 2 hours, maximum you can give it up to a maximum in 72 hours. This is post-exposure prophylaxis. Next is they can ask you how you can stop the vertical transmission. How you can stop the vertical transmission. So if you want to stop the vertical transmission of HIV, so if any pregnant female if any pregnant female is HIV positive, if any female is positive for HIV, and now the baby is born to this mother, so which treatment is given to this baby? So if the mother is already on the antiretroviral therapy, if the mother is already on the antiretroviral therapy, then the baby will get nevirapine or zidovudine. So baby will get nevirapine or zidovudine for 6 weeks. So baby will get nevirapine, zidovudine for 6 weeks, where the nevirapine is a medicine which is a unique medicine name. It belongs to a class of NNRTI. So nevirapine belongs to a class of NNRTIs, and zidovudine is a drug that is NRTI. So this treatment is given for 6 weeks. When the mother is not on antiretroviral therapy, when the mother is not on antiretroviral therapy, then the baby will get both medicine together. The baby will get both medicines together, and this can be given for 6 to 12 weeks, depends on the various other possibilities. So this is how we can prevent the vertical transmission from mother to fetus. Now, when the patient is having HIV with some co-infection, when the patient is having HIV with some co-infection, then always start the treatment of co-infection first. So always start the treatment of co-infection first. So if a patient is having some co-infection, always start the treatment of co-infection first, then start the treatment of HIV. So always start the treatment of co-infection first, then start the treatment of HIV. This you people must be knowing. So if I say the patient is having HIV with TB, so first of all, you start anti-tubercular therapy, and after 2 weeks of time, you start the antiretroviral therapy. First of all, you start ATT, then you start the antiretroviral therapy after the gap of 2 weeks. Now, in this anti-tubercular therapy, there is a drug rifampicin. So, rifampicin is a medicine that can induce the metabolism of dolutegravir. So, dolutegravir is a medicine. Its metabolism can be induced. So, its metabolism can be induced by the rifampicin. So, according to the last year exam, they asked you, okay, what is supposed to be done. So, the thing that is need to be done is we have to add 50 milligram extra dolutegravir. So we have to add 50 milligram extra dolutegravir in the patient treatment when the patient has to take rifampicin also, because this will induce the metabolism of dolutegravir. So it's always better to add 50 milligram extra dolutegravir in the patient treatment. This is what we can do in this patient. Right, guys? So this is the treatment for HIV that you people should be knowing when you're going for the exam. Now, after that, the third topic is malaria. So they can ask you the malaria treatment. So in the last few exams, they have asked you this malaria treatment. So guys, let me tell you, there are two types of malaria present in India. One is P. vivax, second is P. falciparum. So can any one of you tell me which is chloroquine sensitive, which is chloroquine resistant? So P. vivax malaria is chloroquine sensitive malaria, and this is chloroquine resistant malaria. So falciparum is chloroquine resistant, P. vivax is chloroquine sensitive malaria. So if I discuss the treatment of P. vivax malaria, so if I discuss the treatment of P. vivax malaria, this is chloroquine. This is given for 3 days. This is given along with a drug that is primaquine. So this is given along with the drug for primaquine, and this primaquine is given for 14 days. So chloroquine given for 3 days, primaquine given for 14 days. This is the treatment for P. vivax malaria. Now primaquine is a medicine which has three strong contraindication. This medicine should not be given to pregnant female. This medicine should not be given to children and should not be given to G6PD deficiency patient. So we will not give this primaquine to pregnant female, children and G6PD deficiency patient. So in these three patients, we only give chloroquine. We do not give primaquine. So this is the treatment for P. vivax malaria. Now what is the treatment of P. falciparum malaria? So in P. falciparum malaria, which treatment we give? We give artesunate. So we give artesunate to a patient along with pyrimethamine. So we give artesunate along with pyrimethamine plus the combination of sulfadoxine. So this is the treatment that we give as a ACT. So we call it artemisinin combination therapy, where we give artesunate plus pyrimethamine and sulfadoxine combination. This is known as artemisinin combination therapy. This is given along with primaquine. This is given along with primaquine single high dose. So single high dose of primaquine is given along with this above artemisinin combination therapy for falciparum. But here, if the female is pregnant, we have a totally different guidelines. So in pregnant females, we know that primaquine is contraindicated. So primaquine is contraindicated, and even ACT, that is a artemisinin combination therapy, that is also avoided. That is also avoided in first trimester. And because that is avoided in first trimester, that is a artemisinin combination therapy. What do? In first trimester, we only give quinine to the patients. So in first trimester, the best treatment for falciparum malaria is quinine. But in second and third trimester, this artemisinin combination therapy is safe. So we will give artemisinin combination therapy in second and third trimester. So first trimester, we give only quinine. Second, third trimester, we give artemisinin combination therapy. Number three, they can ask you the cerebral malaria. So what is the treatment of cerebral malaria? Now, cerebral malaria is caused by falciparum malaria. So, can any one of you tell me what is the drug of choice? So, in cerebral malaria, whether the patient is pregnant or non-pregnant, it does not matter. So, whether the patient is pregnant or non-pregnant, the best medicine is artesunate. The best medicine is artesunate. The second best medicine is artemether or arteether, right? Second best medicine is artemether, arteether. And the one more medicine that we can give to the patient is quinine. So artesunate is the best medicine to be given for cerebral malaria. This is applicable to all patients, whether they are pregnant, non-pregnant in any trimester. Now the artesunate is a drug of choice for cerebral malaria. Now they can also ask you the malaria prophylaxis. So what is the malaria prophylaxis, guys? So when any visitor coming to India for less than 6 weeks, so less than 6 weeks, we give doxycycline, and for more than 6 weeks, we give mefloquine. So less than 6 weeks, we give doxycycline. More than 6 weeks, we give mefloquine to a patient. This is for the malaria prophylaxis that you must be knowing for the exam. Number five, the question which I think can be asked this time in your exam, when the patient has got the mixed infection. So who will tell me the treatment when the patient has got both Vivex as well as falciparum present together? So when the Vivex and falciparum present together, what is the treatment that is given to a patient? So guys, let me tell you, we give artemisinin combination therapy. We give artemisinin combination therapy, plus we will give primaquine for 40 days. So we will give primaquine for 14 days. Here we will not give the primaquine single high dose. Like you can see over here, in falciparum malaria, we give primaquine single high dose. So here, when both are present, like Vivex and falciparum both are present. So I will take the ACT of the falciparum, plus I will give primaquine for 14 days of the Vivex. So this is how we treat a patient of mixed infection. So this is something which I think is important for this year exam, that how to treat a patient of mixed infection in malaria. Now coming to the topic number 4 that can be important for your exam is antifungal. Now in antifungal, they mostly ask you about the liposomal amphotericin B. Now liposomal amphotericin B is a medicine. This is a cell membrane inhibitor. This is the medicine which is a cell membrane inhibitor. We call it liposomal amphotericin B. The drug is antifungal, cell membrane inhibitor. Now, this is the drug of choice. This is the medicine of choice for mucormycosis. This is the medicine of choice for cryptococcal meningitis. So, this is the medicine of choice for cryptococcal meningitis. This is the medicine of choice for mucormycosis. This is the second drug of choice. This is the second drug of choice for invasive aspergillosis. It's a second drug of choice for invasive aspergillosis, where the drug of choice is voriconazole. So voriconazole is the overall drug of choice for aspergillosis, but this is a second drug of choice, and this is also drug of choice for visceral leishmaniasis. So visceral leishmaniasis is an important indication of liposomal amphotericin B. And one of the important side effect of liposomal amphotericin B is nephrotoxicity. So nephrotoxicity is a important side effect of this medicine, that is liposomal amphotericin B. And in antifungal, what according to me, the most important thing that can be asked in this year exam is this one. They will ask you the drug of choice for invasive aspergillosis. So invasive aspergillosis, the drug of choice is voriconazole. So voriconazole is the best medicine for invasive aspergillosis. Now let's move on to topic number 5. So the topic which is important for your exam, they can ask you the antibiotics indications. So antibiotic indications can be asked. So there is one antibiotic known as azithromycin. So azithromycin is an antibiotic. This medicine belongs to a class of macrolide. So azithromycin belongs to a class of macrolide. This medicine will act on 50S ribosome. This is the medicine that will act on 50S ribosome, and by acting on 50S ribosome, this will inhibit the protein synthesis. Azithromycin inhibit the protein synthesis by acting on 50S ribosome. The drug name is azithromycin. Now, this medicine is drug of choice for some conditions that you can remember with a mnemonic that is CLAW. So here the C stands for chancroid. So chancroid is a condition that is caused by Haemophilus ducrei. So this is a condition caused by Haemophilus ducrei. The chancroid drug of choice is this one, azithromycin. Azithromycin is a drug of choice for chancroid. Now the L stands for Legionella. So Legionella, the drug of choice is amphotericin B. A stands for atypical pneumonia. A stands for atypical pneumonia that is caused by mycoplasma. So this is the drug of choice for mycoplasma, and this is also drug of choice for whooping cough. Azithromycin is a drug of choice for whooping cough as well. So it's a drug of choice for chancroid, Haemophilus ducrei, drug of choice for Legionella, drug of choice for atypical pneumonia, as well as drug of choice for whooping cough. The drug name is azithromycin. Now, who will tell me the name of the bacteria that can cause whooping cough? So what is the name of the bacteria that can cause whooping cough that you people have to answer? Now we have a one more drug. The drug name is doxycycline. Now doxycycline is a medicine. This will act on 30S ribosome. This is the medicine that will act on 30S ribosome. And by acting on 30S ribosome, doxycycline, which is the tetracycline, this is the one that can inhibit the protein synthesis. So this medicine can inhibit the protein synthesis, and this is the drug of choice for scrub typhus and the tick typhus. So this is the drug of choice for scrub as well as the tick typhus. So who will tell me which bacteria can cause scrub and the tick typhus? So scrub typhus, tick typhus, drug of choice, doxycycline. This is the medicine of choice for relapsing fever. So this is the medicine of choice for relapsing fever. This is the medicine of choice for chlamydia. Now chlamydia is a bacteria that will cause lymphogranuloma venerum. Chlamydia is a bacteria that will cause lymphogranuloma venerum, right? Now this medicine is also a drug of choice for granuloma inguinal. So this is the drug of choice for granuloma inguinal. So drug of choice for granuloma inguinal, and this is the drug that is also been used to treat the various infections, like it is given for uh, plague prophylaxis. So this medicine is also given for prophylaxis of plague. So these are the some important indications where we can use this medicine, that is doxycycline. So some important indications of doxycycline we people have discussed. Now here you people have to answer me about one more drug, metronidazole. So metronidazole is a drug of choice for bacterial vaginosis. This is the medicine of choice for bacterial vaginosis, right? The drug is metronidazole. This is also the drug of choice for amoebiasis. Drug of choice for amoebiasis, bacterial vaginosis. The drug name is metronidazole. So these are some important antibiotic indications which I think can be asked in your exam and can be asked and important for this year exam. Out of all, the most important which I think can be asked in your exam is this whooping cough. So guys, please remember the whooping cough drug of choice is azithromycin. Azithromycin is the drug of choice for Bordetella pertussis. This is the most important in this slide to remember. After this antibiotic indications, we can start with the second topic, that is the central nervous system. So in central nervous system, I would say the most important topic to remember is uh, drug de-addiction. So in central nervous system, the maximum thing they will ask you is drug de-addiction. So this is very, very important topic. Every year one MCQ is asked to you. So who will tell me which medicine is best medicine for opioid de-addiction? So which answer you will mark if the question is asked to you? What is the best medicine for de-addiction? what is the best medicine for cravings. So they will give you what is the best medicine to reduce the opioid craving, which is the best medicine to prevent the relapse, which is the best medicine to prevent the relapse of opioid, which is the best medicine for opioid withdrawal, and which is the best medicine for opioid toxicity. So if I talk about this opioid, so opioid de-addiction and cravings, the best medicine you will mark is methadone. So the best medicine is methadone, or you can mark buprenorphine. So methadone is a full agonist of mu receptor. Buprenorphine is a partial agonist of mu receptor. So these medicines are the best medicines for opioid de-addiction or the cravings. Now for the prevention of relapse, you will mark naltrexone. Now naltrexone is an antagonist. Now opioid withdrawal, you will again mark the same medicines, that is methadone and the buprenorphine. So methadone and the buprenorphine are again the best medicines for opioid withdrawal. And for opioid toxicity, naloxone is the best medicine or best antidote you will mark. So naloxone is the fastest acting antidote that you will mark as a best answer for opioid toxicity. So be careful about these questions. For opioid withdrawal, the best medicines are methadone and buprenorphine. Now, the question which is expected this time from you is this one. So they can ask you the best treatment for opioid toxicity. So opioid toxicity, the best treatment is naloxone, not naltrexone. Please remember this point. This is important to remember that the opioid toxicity, the best antidote is naloxone, not the naltrexone. Although both are antidotes, but naloxone is a better medicine for toxicity. Naltrexone is given for prevention of relapse. Now, just like this opioid, we have alcohol also. So if we talk about this ethanol, the same thing. So which medicines we can use for de-addiction and the cravings? So for de-addiction and the cravings of ethanol, the best medicine is naltrexone. Best medicine is naltrexone. The second best medicine is acamprosate. So best medicine is naltrexone. Second best medicine is acamprosate. After that, the second is prevention of relapse. So which is the drug that is given for prevention of relapse? Which medicine can stop the re-intake of alcohol? So re-intake of alcohol is best stopped by again naltrexone. If it is not given, you will mark disulfiram. So disulfiram is a medicine that you will mark as a best, second best medicine for prevention of relapse. This is the medicine that is inhibitor of aldehyde dehydrogenase enzyme. So this is the medicine which is aldehyde dehydrogenase enzyme inhibitor. The drug name is disulfiram. Now the same type of disulfiram like reactions caused by other medicines. Same type of reactions are also caused by other medicines like metronidazole. So metronidazole, cefoperazone, these are the antibiotics which can also result in disulfiram like reaction. So grisophulvin, cefoperazone, metronidazole can lead to this problem that is same as disulfiram. So when any patient who is alcoholic and he will take disulfiram, so a patient on disulfiram therapy, if take alcohol, he can have the problems because one compound will accumulate in their body. The name of the chemical compound is acetaldehyde. So acetaldehyde accumulate in their body and can cause problem. The same problem can be seen with metronidazole, cefoperazone, grisophulvin. So they can ask you this question like in last 5 years, this is asked very, very commonly from you. So metronidazole can cause disulfiram-like reaction along with alcohol. This question is very frequently asked to you in your exam. Now, which medicine is best medicine for alcohol withdrawal? So for alcohol withdrawal, you will mark the best medicine as chlordiazepoxide. So chlordiazepoxide is the best medicine, is the drug of choice for alcohol withdrawal. But guys, please remember, if the patient liver functions are deranged, if the patient liver functions are deranged, then there are two benzodiazepines which are safe. There are two benzodiazepines which are safe. The medicines names are lorazepam and oxazepam. So whenever the liver functions are deranged, two medicines are safe. One is lorazepam and oxazepam. Yes. So Dr. Manjeet Baisla has answered this question. कि sir withdrawal में we will not give only chlordiazepoxide, we also give vitamin B1. Yes, this is correct, Dr. Manjeet. We will not give only chlordiazepoxide, we give it in combination with vitamin B1. Now this is important to remember for this year exam कि lorazepam and oxazepam are two liver okay benzodiazepine. These are the two liver okay benzodiazepines. So liver okay means the lorazepam, oxazepam, safe to use in patients who have the alcohol withdrawal, but their liver functions are deranged. Okay, the last is alcohol toxicity. Now, alcohol toxicity, they will never ask you. So rather, they will ask you the methanol toxicity. So methanol toxicity, fomepizole is an antidote. So for methanol toxicity, that's a different from ethanol. That is a fomepizole that you have must have covered in forensic medicine. Third is nicotine de-addiction. Now for nicotine de-addiction, which medicines we can use? So for nicotine de-addiction, we can use nicotine itself as a drug. So nicotine itself is used as a drug. One more drug is varenicline. So varenicline can be used as a drug. Number three, one more drug is bupropion. So three medicines have got approval for nicotine de-addiction. One is nicotine, varenicline, and bupropion. So nicotine is easy to remember. Varenicline is having a word nicotine. So this is the medicine that is used. And for bupropion, you can remember like this way. It is having a word PO in its name. And in Hindi, we say that कि cigarette पीते हैं. So this medicine can help you to leave the cigarette. This will stop you to PO the cigarette. Or bupropion is also having a word pro. So you can also remember like this way. If you want to become a pro person in your life, you have to quit smoking. So if you want to become pro, then you have to leave the smoking, bro. This is how you can make the mnemonic of bupropion. This is all about the most important topic in CNS, that is drug de-addiction. Now, after this drug de-addiction topic, the next topic which can be asked in your exam is the antidepressants. So antidepressants classification. So antidepressant classification, guys, please remember there are three types of antidepressant medicines we have. So we have typical antidepressants, we have typical antidepressants, we have serotonin modulators. So we have typical antidepressants, we have serotonin modulators, and we have atypical antidepressant medicines. Now, guys, how we have classified these medicines, this you people have to remember. Typical medicines will have the maximum sexual side effect. Maximum sexual side effect. They have the less sexual side effects, and atypical medicines have no sexual side effect. So this is something they have asked you many a times in last 5 year exam. Like which antidepressants will not cause sexual dysfunction? So which antidepressants will not cause sexual dysfunction? Answer is atypical medicines. And which medicines belong to this class? The answer is bupropion. The same bupropion that we use for smoking de-addiction also. So bupropion, metazapine, so bupropion, mirtazapine, and agomelatine. These are the three medicines that belong to this class. So three medicines that will not cause sexual dysfunction. The medicines are bupropion, mirtazapine, and agomelatine. So some students make the mnemonic like this way. They make the mnemonic like Bumrah. So they make the mnemonic like Bumrah. So they make the mnemonic like Bumrah Ji. So this is Bumrah G. G is ago. Like, so do you know who is Bumrah? Like, do you have any idea what is Bumrah? Which person is Bumrah? Like, which sports this person plays? Any idea about Bumrah? Okay, so we have a medicine class. We call them serotonin modulators. They have the less risk of sexual side effects. So which medicines belong to this class? The medicines are trazodone. So we have a drug trazodone, and the important side effect of trazodone is priapism. So trazodone is a medicine that belongs to this class, and the important side effect is priapism. Now we have a typical medicines, that is SSRI. So medicines are SSRI. Now SSRIs are drug of choice for depression as well as drug of choice for all type of anxiety and anxiety related disorders. Yes, so Manjeet has answered कि Bumrah is a bowler of India. So just remember Manjeet कि Bumrah को sexual dysfunction is नहीं है. Bumrah is not having a sexual dysfunction. So Bumrah is not having a sexual dysfunction. He used to play from the Punjab Super Kings, and I think Manjeet is also from Punjab Super King. I mean from Punjab, not from Super King. So Bumrah को sexual dysfunction नहीं है. So SSRI is drug of choice for all type of depression, all type of anxiety disorders. Now, which medicines belong to this class? Medicines are fluoxetine, fluvoxamine. So medicines are fluoxetine, fluvoxamine, right? One more drug is escitalopram. One more drug is escitalopram. One more drug is paroxetine. So these are the some examples of the drugs which are known as SSRI. So medicines are fluoxetine, fluvoxamine, escitalopram, and paroxetine. Right? So some students make the mnemonic like this way. If you want to escape from the flu, so this is flu. If you want to escape from the flu, take paracetamol. So if you want to escape from the flu, take paracetamol. So fluoxetine, fluvoxamine, escitalopram, paroxetine. So if you want to escape from the flu, take paracetamol. So this is the mnemonic to remember the medicine's name. One more drug that belong to this class is sertraline. Now sertraline is a drug that start with the word serotonin. So this medicine start with the word serotonin. So this is also an SSRI. Now, these medicines will cause maximum sexual dysfunction. So, medicines most common side effect is GAT toxicity. So, most common side effect is nausea, vomiting, diarrhea. But medicine's second most common side effect is anorgasmia. So, these medicines can delay the orgasm. Medicines can cause sexual dysfunction. So, very high incidence of sexual dysfunction. The medicines can cause anorgasmia. Number two group of medicines that belong to this class is SNRIs. So we have a serotonin noradrenaline reuptake inhibitors. So serotonin noradrenaline reuptake inhibitors. Just remember the medicines names like venlafaxine, deloxetin, and milnacipran. So three medicines belong to this class. One is known as venlafaxine, deloxetin, and milnacipran. So some students make the mnemonic like this way कि when दूल्हा या दुल्हन मिलना. So when दूल्हा and दुल्हन मिलेगा या मिलेगी. So when दूल्हा मिलेगा या मिलना, that is SNRI, venlafaxine, deloxetin, and milnacipran. Now we have a last class of medicines. We call them tricyclic antidepressants. Now all these medicines have the word tri in their name. So we have the drugs like amitriptyline and nortriptyline. And what is the antidote of choice for their toxicity? So antidote of toxicity of this medicine is antidote of TCA toxicity is sodium bicarbonate. So sodium bicarbonate is a medicine which is the antidote of choice for TCA toxicity. So TCA toxicity, the antidote of choice for sodium bicarbonate, sodium bicarbonate. And during this TCA toxicity, patient can have the problems like seizures, patient can have the low BP, patient can have the arrhythmias. So arrhythmias, low BP, seizures, dry mouth, dry eyes can occur. So these are the some important side effects of these medicines that can occur when the patient will have the TCA toxicity. So this can be asked in your exam. So out of all this, if you ask me, sir, just tell us one question uh, that we need to study when we are going for the exam. So I would say you should remember this point: the medicines, like the sexuality, like the what is the side effect on the sexuality. So this is something very important. Maximum side effect, typical drugs, minimum side effect or no side effect by atypical medicines. So atypical medicines names are important. So what are the names of medicines? Like the mnemonic is Bumra. So we have bupropion, metazapine, and the agomelatine. Okay, guys. So this is all about that topic antidepressant drug. Now, after this antidepressant medicines, let's move on to topic number, like which can be asked in your exam, is a second generation antipsychotics. So second generation antipsychotic, we call them atypical antipsychotics. So second generation antipsychotics or atypical antipsychotic is a topic which is important for the exam. Now, all these medicines which are second generation antipsychotics are inhibitor of 5-HT2 receptor. So all these medicines are inhibitor of 5-HT2 receptor, but also they block the dopamine receptor. So all these medicines block 5-HT2 receptor, but also block D2 receptor. But there is one exception that you people have to remember. The exception is aripiprazole. Now, aripiprazole is a medicine which is 5-HT2 blocker, just like any other drug, but this is partial D2 agonist. This is the medicine which is partial D2 agonist medicine. Now, you also have to remember the important side effect of these medicines. So here we have a drug clozapine. So clozapine is very efficient drug belong to this class, and this is the medicine that will cause most of the side effects maximally. So this is the medicine clozapine. It's a drug of choice for refractory cases. This is the drug of choice for refractory cases of psychosis, that is schizophrenia. It's the best medicine for refractory schizophrenia. The drug name is clozapine. This medicine can lead to many side effects. Like one of the most important side effect of this medicine is agranulocytosis. One more side effect of this medicine is cyalluria. So medicine can cause cyalluria, agranulocytosis. Medicine can cause myocarditis. Medicine can cause seizures. So the important side effects you can remember with the mnemonic, that is MAS, right? So agranulocytosis, myocarditis, seizures, all these are important side effects this medicine can cause. So medicine important side effects you can remember with the mnemonic like MAS, agranulocytosis, cyalluria, myocarditis, and seizure. Now apart from that, this medicine can cause maximum weight gain. This is the drug that will cause maximum weight gain. But if question is asked to you, which drug will cause minimum weight gain? Out of all antipsychotics, which medicine will cause minimum weight gain? The answer is ziprasidone. So ziprasidone is a medicine that will cause minimum weight gain. And if question is asked to you, which medicine will cause overall side effects minimally? So overall side effects minimally seen with a drug that is known as aripiprazole. So aripiprazole is a medicine that will cause overall minimum side effect, and clozapine is a drug that will cause maximum side effect. But only the weight gain is a side effect, which is asked to you in your last exam. Ziprasidone is the only drug that will cause minimum weight gain that you people have to remember. So this is the eighth topic that where you have to put more concentration when you're going for the exam. Ninth is the drug is lithium. So lithium is a drug of choice for bipolar disorder. Lithium is a drug of choice for bipolar disorder, and body cannot differentiate between lithium and sodium. Lithium is a drug that is given only by oral route. Lithium is a medicine that is given only by oral route. Body cannot differentiate between lithium and sodium. The medicine half-life is approximately 24 hours. So medicine half-life is approximately 24 hours. This is given only by oral route, right? And lithium is a drug that is eliminated by kidney. This is the medicine eliminated by kidney. And when you give lithium to a patient, its important side effects you can remember with the mnemonic. The mnemonic is lithium itself. So this medicine can increase the leukocyte count. So lithium is a medicine that will increase the WBC count. Increase leukocyte is a side effect. This is the medicine, the most common side effect. The most common side effect of this medicine is fine tremors. Most common side effect is fine tremors. Increased leukocyte is a second side effect. This is the medicine that will cause hormonal imbalance. So this medicine can result in hormonal imbalance. So in this hormonal imbalance, this will cause hypothyroidism. You have to remember these side effects. Hyperparathyroidism that will lead to hypercalcemia and can inhibit anti-diuretic hormone. So three hormonal problems this medicine can cause. Hypothyroidism, hyperparathyroidism can cause deficiency of anti-diuretic hormone that will result in polyuria. So this will result in polyuria. Apart from that, this medicine can increase the body weight. So one more side effect is weight gain, increase the body weight. This medicine can cause U wave in ECG. So medicine can cause ECG changes, U wave in ECG. And when this medicine is given to mother, like a pregnant female, so when this medicine is given to pregnant female, the baby is born with a syndrome that's known as Epstein's anomaly. So baby is born with the syndrome of Epstein's anomaly, where the baby, okay, who you tell me guys, when this medicine is given to pregnant female, which is the most important question that can be asked this time in your exam, the baby will have the Epstein's anomaly. So Epstein's anomaly में which organ of the baby, right? So which anomaly, like which organ of the baby is affected? So who will tell me which organ of the baby is affected? So which organ of the baby is affected in Epstein's anomaly? That you people have to answer me this question. So this is something most important to remember regarding this drug, lithium, for this year exam. Now, 10th topic they can ask you is the treatment of neuralgia. So treatment of neuralgia they can ask you. So if I ask you this question, guys, what is the drug of choice for trigeminal neuralgia? So what is the drug of choice for trigeminal neuralgia? What is a drug of choice for post-herpetic neuralgia? What is a drug of choice for post-herpetic neuralgia? What is a drug of choice for diabetic neuralgia? So what is the drug of choice for diabetic neuralgia? What is a drug of choice for what is a drug of choice for spinal cord injury neuralgia? So drug of choice for spinal cord injury neuralgia, drug of choice for parieto-temporal lobe, parieto-temporal lobe neuralgia. So parietal temporal lobe neuralgia. So neuralgia where the parieto-temporal lobe is involved. So parietal temporal lobe neuralgia, which medicines are given as a best medicine? So for trigeminal neuralgia, guys, please remember carbamazepine, oxcarbamazepine are the drug of choice. For post-herpetic neuralgia, the medicines of choice are tricyclic antidepressants. So nortriptyline. So nortriptyline is the best answer, followed by the pregabalin and gabapentin. For diabetic neuralgia, you can mark duloxetine, or second you can mark the pregabalin and gabapentin. So duloxetine is SNRI. So this can be marked, and pregabalin gabapentin can be marked as a best medicine. For spinal cord injury neuralgia, you will mark pregabalin gabapentin. And for parieto-temporal lobe involvement and having neuralgia, we will give carbamazepine. So carbamazepine is a best medicine for this kind of neuralgia where the parieto-temporal lobe is involved. Now here they will ask you the side effects of carbamazepine. So what are the side effects of carbamazepine? They can ask you. So for carbamazepine side effects, you can remember this mnemonic, that is CASH. So CASH is a mnemonic that you can remember. So this medicine can result in cerebellar ataxia. So this is the drug that will cause cerebellar ataxia and diplopia. This is the medicine that will cause agranulocytosis. So carbamazepine, clozapine, both medicines can cause agranulocytosis as a side effect. This is the medicine that will cause SIADH-like symptoms. Now, as a result of this SIADH-like symptom, this carbamazepine can cause water retention. And because of water retention, the sodium get diluted. When the sodium get diluted, the sodium level will go down. The medicines will cause hyponatremia. Now, this is the side effect of hyponatremia or water retention that is more commonly seen with oxcarbazepine than carbamazepine. And this is something is a highly expected MCQ for this year exam. So highly expected MCQ for this year exam is this one. And H stands for hypersensitivity reaction. H stands for hypersensitivity reaction, the side effect of carbamazepine. Now they can also ask you which antiepileptics are given for migraine. So migraine is also the pain. So which antiepileptics are given for migraine? So we have sodium valproate and topiramate. So sodium valproate and topiramate are two antiepileptics which are given for migraine. And one of the most important side effect of sodium valproate is the liver toxicity. So liver toxicity is the most important side effect of sodium valproate. So we have to give an antidote for that. We have to give an antidote for that to prevent the liver toxicity caused by valproate. They can ask you the antidote ka naam. They can ask you the antidote of choice is carnitine. So carnitine is used as an antidote to avoid the liver toxicity caused by sodium valproate. So this is all about the central nervous system. So central nervous system, all important questions we have discussed. So I can see from the chat, many of you are answering correctly. Dr. Smart Surgeon, Surgeon Smart, Smart Surgeon has answered all questions correctly. Manjeet is participating. Raksha is participating. It's good. Black Moon is participating. It's good to see you guys that you people can recall these things. Now, after this CNS and the antimicrobial, the next topic is endocrine. So I'm moving on to the next topic, that is the endocrine. So topic number 11 is the medicines that we can use for diabetes mellitus. So medicines that we can use for diabetes mellitus, the one is insulin. And in insulin, guys, just remember one drug, that is D-glutec. So medicine is D-glutec. So D-glutec is the longest acting insulin. So this is the longest acting insulin. Otherwise, this insulin topic is not very important for exam. You can leave this topic in case you want. Then comes the insulin secretagogues. So insulin secretagogues are those medicines of diabetes which can directly stimulate the beta cell of pancreas. So these are the medicines that will directly stimulate the beta cell of pancreas, right? So we call them insulin secretagogues. They directly stimulate the beta cell of pancreas and they have very high efficacy. So they have very high efficacy in the treatment. Now, which medicines belong to this class? This is important to know. So the medicines are known as sulfonylureas. Medicines are known as sulfonylureas. All medicines start with the word G, L, and I. So all medicines start with the word G, L, and I. So all these medicines name starts with the word GLI. So these are the drugs, we call them sulfonylurea. So last year in your exam, this question was asked. So this was the question asked last year in your exam. They asked you if patient ka diabetes is not getting controlled, which medicine you will add. So answer is sulfonylurea we can add. And these medicines are given by oral route, so patient is comfortable. Number two, the medicines which are known as GLP-1 analogs. So we people have discovered the new medicines which are known as GLP-1 analogs. All medicines end with the word glutide. All medicines end with the word glutide. So the medicines which belong to this class are liraglutide and semaglutide. So medicines which belong to this class are liraglutide and semaglutide. Now these medicines are anti-diabetic medicines. They can control diabetes. Now these medicines will not cause hypoglycemia. These are the drugs that will not cause hypoglycemia as a side effect. Number one point. Second point, these are the medicines which have become the first line drug for obesity. So these are the drugs which have become the first line medicines for obesity. So this is also very important to know. Third thing that you can remember is these medicines are given by subcutaneous route. So no hypoglycemia, first line drug for obesity because these medicines can result in massive weight loss. So these are the medicines that will cause weight loss. So these medicines have become the first line drug for obesity. The medicines are liraglutide, semaglutide given by subcutaneous route. And these are the drugs which have the maximum risk of pancreatitis as a side effect. Maximum risk of pancreatitis as a side effect. This is a side effect of liraglutide, semaglutide. So students make the mnemonic as the medicines are given for obesity. So they make the mnemonic like lean sema. So they make the mnemonic like lean sema. So lean sema is lean. So liraglutide and semaglutide. So sema is the name of a female who is lean. So lean sema are the medicines that we use for obesity given by subcutaneous route and maximum side effect is pancreatitis. Right. Number three, we have a medicines, we call them DPP4 enzyme inhibitors. So all these medicines end with the word gliptin. So all these medicines end with the word gliptin. So we have the medicines like sitagliptin, linagliptin. So we have the medicines like sitagliptin, linagliptin. So these medicines are DPP4 enzyme inhibitors. Now, these medicines will not cause hypoglycemia. So, just like the above medicines, they will also not cause hypoglycemia. But these medicines are given by oral route. So, medicines are given by oral route, no hypoglycemia. And out of these medicines, linagliptin is a medicine. This is safe to use in CKD patients. So in kidney disease patient, linagliptin is a medicine that is safe to use. So linagliptin is a medicine that is safe to use in patients of CKD. So CKD patients में linagliptin is a medicine that is safe to use. The medicines end with the word gliptin. So we call them DPP4 inhibitors. Okay, guys. The question that can be asked in your exam we'll discuss now, like not now, like after this group. So we have a third medicine that will decrease insulin resistance in periphery. So third medicine that will reduce insulin resistance in periphery. So this will increase glucose uptake. The medicine that will increase glucose uptake in the tissues. So glucose will start taking entry in tissues, reduce the insulin resistance. So the medicine name is metformin. So metformin is the drug of choice for diabetes mellitus 2. This is the best medicine for diabetes mellitus 2. We call it metformin. So metformin is a medicine. This is the best medicine for diabetes mellitus 2, right? And they can ask you the important side effect of this medicine. So this metformin is a drug that will cause weight loss. This medicine can cause vitamin B12 deficiency. So can result in vitamin B12 deficiency, weight loss, One more side effect is lactic acidosis. So can result in lactic acidosis, but the most common side effect is nausea. So most common side effect is nausea. So nausea is the most common side effects. Other side effects are lactic acidosis, vitamin B12 deficiency, and weight loss. So can any of you make the mnemonic of these side effects of metformin? Then I will, anyone who will make a good mnemonic, I'll give you one extra tip for that. That's a personal level. So if you can make a good mnemonic of these four side effects of metformin, because this is something very important for exam, the metformin side effects. The question that is going to be asked this time is the medicine that will increase glucose elimination from the body. So medicines that can increase glucose elimination from the body, we call them SGLT2 inhibitors. So medicines are known as SGLT2 inhibitors. All these medicines end with the word gliflozin. So one of the classical example is empagliflozin. One more example is like dapagliflozin. So we have the examples of the medicines like empagliflozin, dapagliflozin. Now, when these medicines are given to a patient, one of the important side effect of medicine is UTI. So this is something going to be asked this time in your exam, right? So guys, this is very, very important. So they will ask you which anti-diabetics can increase the risk of UTI. This is something very important for exam. So this you should not leave. Now, these medicines also have got approval for congestive heart failure. So these medicines are not only anti-diabetic, they will also cause congestive heart failure as a side effect. Right, guys? So this is all about this topic of diabetes. So that is some diabetes to confirmed hai, the medical questions are going to be asked. So some questions I have highlighted over here. So you should put more stress on this topic, that is diabetes mellitus. Now, after this diabetes mellitus, they can ask you the Graves' disease. So they can ask you the drug of choice for Graves' disease. So Graves' disease, also known as hyperthyroidism. So which medicines are drug of choice for Graves' disease? Which medicines are best medicines for Graves' disease? So the drug of choice for maintenance treatment. Drug of choice for maintenance treatment is carbimazole. So carbimazole is a drug of choice for maintenance treatment. And they can ask you which medicine is drug of choice for thyrotoxicosis. So the medicine of choice for thyrotoxicosis is propylthiouracil. So propylthiouracil is a drug of choice for thyrotoxicosis. Carbimazole is a drug of choice for maintenance treatment. But the more important they will ask you is pregnancy. Like which medicine is best medicine in first trimester of pregnancy? Like 1 to 13 weeks of pregnancy. Which medicine is safe to use in second and third trimester of pregnancy from 13 to 40 weeks of pregnancy? If you are able to answer this question, it means you have prepared well for the exam. So pregnancy ka answer you people will give by yourself, right? Now I will tell you the important side effect of carbimazole. So one of the important side effect of carbimazole is agranulocytosis, and the important side effect of PTU. Important side effect of this medicine, that is PTU, is hepatotoxicity. So important side effect of propylthiouracil is hepatotoxicity, and carbimazole important side effect is agranulocytosis. Very good. So Dr. Manjeet has given the answer. In first trimester, we will give propylthiouracil, and in second, third trimester, we will give again carbimazole. So carbimazole is a medicine of choice in second, third trimester, and in first trimester, we will give propylthiouracil as a best medicine. So this is something they will ask you. So most of the time in hyperthyroidism, they ask you the drug of choice. So drug of choice is important in different stages of life. So that is something they ask you in hyperthyroidism. Now, topic number 13 is based on the reproductive hormone drugs. So reproductive hormonal drugs. So reproductive hormonal drugs, they can ask you. So if we talk about the reproductive hormonal drugs, so in reproductive hormonal drugs, if I talk about the male pathway, so in males, they will ask you the medicines which are known as 5-alpha reductase enzyme inhibitors. So the medicines which are 5-alpha reductase enzyme inhibitors. So the medicines which are 5-alpha reductase enzyme inhibitor, these medicines end with the word ride. So the medicines names are finasteride, dutasteride. So medicines names are finasteride and dutasteride. So finasteride, dutasteride are the medicines which are 5-alpha reductase inhibitors, and these medicines are the drug of choice for androgenic alopecia. These are the best medicines for androgenic alopecia, and these medicines are the second drug of choice for benign prostate hyperplasia. Second drug of choice for benign prostate hyperplasia and drug of choice for androgenic alopecia. The medicines are 5-alpha reductase inhibitor. So in male hormone, this topic is important. If we talk about female hormone, there is a topic that is known as SERM. So we call them selective estrogen receptor modulators. Selective estrogen receptor modulator. The drug name is tamoxifen. Now, tamoxifen is a medicine that we can use for treatment as well as prophylaxis of breast cancer. So we can use this medicine for treatment and prophylaxis of breast cancer. So treatment and prophylaxis of breast cancer, tamoxifen is used, and this is the medicine that will cause one important side effect as endometrial carcinoma and cataract. So cataract and endometrial carcinoma, the side effect. The medicine side effect is endometrial carcinoma and cataract in eyes. You can see the medicine side effect starts with E, endometrium and eyes, and CA means cancer, CA means cataract. So can cause endometrial cancer, that is ECA, that is endometrial carcinoma, and also it is given for it can cause cataract in eyes. So this is the medicine they can ask you in exam, that is tamoxifen. Number three medicine that you should read is medicines that will act on progesterone pathway. So medicine that will act on progesterone pathway, you should be knowing about the medicines like levonorgestrel. So levonorgestrel is a medicine. It's a most commonly used medicine for emergency contraception. Most commonly used medicine for emergency contraception, and 1.5 milligram is a dose that female need to be taken within 72 hours of unprotected intercourse. So within 72 hours of unprotected intercourse, the female is supposed to take levonorgestrel 1.5 milligram. We have a medicine here. The drug name is ulipristal. Now ulipristal is selective progesterone receptor modulator. Selective progesterone receptor modulator. Now, this medicine dose is 30 milligrams stat for emergency contraception. For emergency contraception, 30 milligram single dose need to be taken, and this need to be taken up till 5 days. So this can be taken up till 120 hours, that is 5 days. The drug name is ulipristal. We call it selective progesterone receptor modulator. Now we have a drug mifepristone. Now mifepristone is a medicine which is a progesterone antagonist. So this is the medicine which is a progesterone antagonist. The drug name is mifepristone. It's a progesterone antagonist medicine, and this is the medicine that we use for MTP. So this is the drug that we use for MTP, and for MTP in first trimester, the female will take mifepristone 200 milligram on day 1, and after 24 hours of mifepristone, she is supposed to take what's the second drug, that is misoprostol. So she can take prostaglandin E1 analog, misoprostol. So mifepristone is progesterone antagonist. She can take. So Manjeet, ulipristal is up till 5 days, not up till 3 days. The levonorgestrel is up till 3 days. And if female forgets to take the levonorgestrel, then she will take ulipristal. Now abortion का regimen is mifepristone 200 milligram by oral route, and she can take misoprostol 200 microgram. 200 microgram, 4 tablets. So 4 tablets of 200 microgram. You can see the mifepristone is in milligram and this is in microgram. So mifepristone is in milligram, this is in microgram. So she will take 4 tablets of 200 microgram, and mifepristone she will take 200 milligram of this mifepristone. So these are the medicines which are important in relation to your reproductive hormone. Out of all these, if you ask me, sir, tell us the one drug which can be asked. So that is tamoxifen. So tamoxifen is most important drug that is given for breast cancer, and its important side effects are endometrial cancer and cataract in the eyes. So endometrial cancer asked last time in your exam. This may be asked again because this is something most important here. So topic number 13, the sexual hormones we people have covered. Now, after that, the 14th topic they can ask you about the treatment of acromegaly. So, what is the treatment of acromegaly? So, acromegaly is excess of growth hormone. So, excess of growth hormone, that is acromegaly. So, here you will mark the drug of choice is somatostatin analog. So, somatostatin analog is the best treatment for acromegaly. The medicine name is lenriotide. So lenriotide subcutaneous depot is the best treatment. In case it is not given, you will mark octreotide. So somatostatin analogs, lenriotide, octreotide are the best medicines to be given as a best treatment for acromegaly. Now, in case the condition is not controlled, we can give the other medicines like pegvisomant. We can also give a medicine that is pegvisomant. So we have a somatostatin analog. You can see somatostatin means that will make everything static. So this is the hormone that will make everything static. So this is the inhibitor of pituitary, and this will inhibit the release. This will inhibit the release of growth hormone from the pituitary gland. So somatostatin will inhibit the release of growth hormone from the pituitary gland. Medicine is lenriotide, octreotide. But if the condition is not controlled, we can give a medicine pegvisomant. Now pegvisomant is an antagonist. Pegvisomant is an antagonist of somatropin hormone. It's an antagonist of somatropin hormone. The somatropin antagonist is pegvisomant. So this I can try. I can also give a medicine that is cabergoline. Now, cabergoline is a drug which is dopamine receptor agonist. So, cabergoline is dopamine 2 receptor agonist. So, this can be the medicine that I can give. Now, if you ask me, sir, out of these, which is the most important? So, this is something most important. It is a somatropin receptor antagonist. Pegvisomant, somatropin receptor antagonist. Somatropin is a name of a growth hormone. Like it's not any new hormone in your body. It's just a other name of growth hormone. So it's a growth hormone receptor antagonist, pegvisomant, given in those cases where the lenriotide is not able to control. So lenriotide they asked you 3 years back, but this time they can ask you the pegvisomant. This is important, right? So topic number 14 based on acromegaly that we people have covered. Now, after that, this is all about your endocrine system. Now, after this endocrine, they can ask you uh, general pharma. So, if you talk about this general pharma, so in general pharma, they can ask you the types of receptor. So, types of receptor can be asked in general pharma. So, I think the topic number 15. So 14 was the previous one. The 15th topic that can be asked is types of receptors. So here you people have to mark which are the nuclear receptors, which are the cytoplasmic receptors, and which are the membrane receptors. So receptors which are the membrane receptors, we call them the surface receptors. So membrane receptors, we also call them the surface receptors, cytoplasmic receptors, and nuclear receptors. Now, these membrane receptors can further be of two types. They can be associated with kinase enzyme activity. So, they can be associated with kinase enzyme activity, or they may be associated with G protein activity. We call them G protein coupled receptor. So, which receptors are nuclear receptors? Here you can remember this mnemonic tape. So thyroid hormone. So thyroid hormone receptor is nuclear receptor. Vitamin A receptor. Vitamin A receptor is a nuclear receptor. We have a PPAR receptor. So we have a receptor that is known as PPAR receptor. This can be PPAR alpha. This can be PPAR gamma. Now we have the estrogen receptors. Estrogen receptors are the nuclear receptors. Now the cytoplasmic receptors are the all steroidal receptors. So all steroidal receptors, all type of steroids, we have the cytoplasmic receptor. All our sex hormone receptors. All our sex hormone receptors like testosterone, estrogen, progesterone. So we have the receptors in cytoplasm. You can see estrogen receptors are present at both locations. So most of the time they will not put question on estrogen because estrogen has two locations, nucleus as well as cytoplasm. Number three, vitamin D receptor. So vitamin D receptor, sex hormone receptor, steroidal receptors are cytoplasmic receptor. Now we have the kinase receptor. So which hormones will act through this kinase receptor? That is, the mnemonic is PIG. So mnemonic is PIG or PGI, whatever you want to remember, Postgraduate Institute or PIG. So I'm just following the mnemonic PIG. So P stands for prolactin, I stands for insulin. Right? So prolactin, insulin, growth hormone, and growth factors. So prolactin, insulin, growth hormone, growth factor. So this is the mnemonic to remember the medicines which have the receptors in membrane associated with kinase enzyme activity. Now all other drugs will act on G protein coupled receptor. So all other drugs will act on G protein coupled receptor. Now they will ask you further questions on G protein coupled receptor. They will ask you the shape of the receptor. They will ask you the shape of this receptor. You should be knowing the shape of the receptor, and also you would be knowing the active form of the receptor. So the active form of the receptor is the GTP form, where the G alpha is the active form. So the active form of the receptor is G alpha. And what is the shape of the receptor? That you people will answer me. And if you ask me, sir, कि इनमें से एक topic बताओ, like one topic which is most important for this year exam. So that is going to be this one. So they will ask you the insulin receptor location. They'll ask you the location of insulin receptor. What is the location of insulin receptor? Answer is membrane receptor associated with kinase enzyme activity. Now, if they will ask you which kinase enzyme, answer is tyrosine kinase. So insulin receptor is membrane receptor associated with tyrosine kinase activity. So this is something very important for this year exam. Yes, the shape of the receptor, Dr. Manjeet has given the correct answer. It's a serpentine shape. Serpentine means the snake-like shape, and this snake has 7 helix. So 7 helix structure is there, serpentine structure is there. This is the structure of G protein coupled receptor. Now let's move on to the next topic. The next topic is the 16th topic. So they can ask you the DRC, the dose response curve. So if we talk about this dose response curve, so if I draw the structure of the dose response curve, the structure is like this way. So here we take the dose in logarithm scale. Here we take the dose in the logarithm scale, and we will take the response. We will take the response in the y-axis. So dose is taken in logarithm x-axis. Dose is plotted on x-axis, response is plotted on y-axis. This is dose response curve. We also call it sigmoid shape curve. So this is also known as sigmoid shape curve. The shape is known as sigmoid. Now here they will ask you the questions like, what is therapeutic index? So in this DRC, we can calculate therapeutic index. And what is therapeutic index, guys? The therapeutic index is division of lethal dose 50 with effective dose 50. So therapeutic index is index of safety. So therapeutic index is index of drug safety. This will tell you which drug is safe to use, which drug is unsafe to use. And this is the ratio of LD50 upon ED50. So if this ratio comes out to be more than 2, if this ratio is more than 2, I will say the medicine has wide therapeutic index. If this ratio comes out to be less than 2, I will say the medicine has narrow therapeutic index. Now here you people have to answer me, what is the definition of LD50 or ED50? So guys, please remember those at which 50% of the sample population, 50% of your sample population show you the response. 50% of your sample population shows you the response, that is known as ED50, and those at which 50% of your population will die. Like if you're doing the animal experiment, the 50% of your population will die. That is known as lethal dose 50. And if you take the fraction, if you take the ratio, that will give you the therapeutic index. So in graph, we can show this doses like this way. So the left side graph is showing you the medicine effect, and the right side graph is showing you the medicine lethal effect, right? So this is the therapeutic effect of the medicine. This is the therapeutic effect when the medicine will show you the response, the patient's disease is treated. And lethal effect means when the animals or the samples will start dying. So obviously guys, on x-axis we have taken the dose. So lethal dose is always higher. The right side means the lethal dose is always higher. The left side means the effective dose, this is always less. So this is a 50% patients. So number of patients, number of samples I have taken on the y-axis. So 50% patients show me the response. So these are the 50% patients show you the response. This is ED50. And when 50% patients show you me the lethal effect, that is known as LD50. So this is how we calculate this ED50 and LD50. And when we take the ratio, this will give you a therapeutic index. So this is what they can ask you. Number two, in this DRC, they can ask you the comparison of drugs. So they can ask you the comparison of drugs, like how will you compare one drug from other? Now, whenever you have to compare one drug from other, you always compare in terms of potency and the efficacy. So you always compare in terms of potency and the efficacy. So guys, potency is the minimum dose. Potency is the minimum dose that is required. Potency is the minimum dose required to produce a certain effect. So it's a minimum dose required to produce a certain effect in the body is known as the potency. So potency is the minimum dose that is required to produce a certain effect. So potency is minimum dose. So that is seen on x-axis. And one very simple thing is if the medicine DRC, if the medicine DRC is on the left side of the other drug, if the medicine DRC is on the left side of the other drug, like the other drug DRC is on the right side, and the medicine which you are discussing right now is on the left side. The medicine DRC is on the left side. It means that drug is more potent. But if the medicine DRC is on the right side, it means that drug is less potent. So if I discuss with you, like this is the graph, this is drug A, drug B, drug C, and drug D. So if I ask you this question, guys, which drug is most potent? You can see the graph of A is on the left side. So we will say A is most potent, followed by B, then C, then D. So left side means the more potency, right side means the less potency. Right, guys? And what is efficacy? Efficacy is nothing, just the maximum response of the drug. So this is the maximum response of the drug in the body. So this is the maximum response that is seen on the y-axis. And one very simple rule is for the efficacy, more is the height. More is the height of DRC, medicine efficacy is more. Less is the height of DRC, medicine efficacy is going to be less. So who will tell me? In this graph, which drug is most efficacious? Answer is D, followed by A, then C, then B. So B has minimum efficacy, D has maximum efficacy. So this is how you calculate the efficacy of the medicine by looking at the height of DRC. Now they can also ask you what is the effect of competitive versus non-competitive blocker on DRC. So whenever you give competitive or non-competitive blocker of a drug to a patient, what will happen to its DRC? So if I say the competitive block, so in the competitive block, your drug is A. So drug DRC shifted towards the right side. So right shift of DRC, whenever you see the right shift of DRC, this is competitive block. And how will you explain the non-competitive block? The non-competitive block is flattening of DRC. So whenever you see the flattening of DRC, whenever you see the flattening of DRC, this is the non-competitive block. So flattening of DRC, non-competitive block. Right shift of DRC, this is competitive block. Okay, guys. So in general pharma, if you ask me, कि sir, एक question बता दो, that is going to be asked. So the question that is going to be asked in your exam is this one. You have to answer me. This graph is showing you what? So this is the graph. This graph gives you which information? This is the question that is going to be asked. So this is the graph you will get in the exam and they will ask you, okay, this graph gives you which information? So answer is, anyone can answer. This graph gives you which information? Anyone would like to answer? Okay, so I'll explain. So guys, see, whenever you get this kind of questions, you always check the medicine name. So if you find the medicine name is changing, it means now they have given you the graph of two drugs, A and B. Now you can only compare the drugs. You can only say कि A and B have same efficacy and A is more potent than B. Here you cannot say it's a competitive block. The reason you have to understand, the drug is changing. If I give you graph like this way, like this is A and this is also A. Now you will say, ki, sir, the below graph is showing you the competitive block. So second is showing you the competitive block because you can see the drug is same. So competitive, non-competitive, you can only answer when your drug is same. But if your drug is changing, be careful. You cannot answer about competitive, non-competitive. You have to only answer the comparison of drug, that is in terms of efficacy and potency. So in the above graph, you can say A and B are equally efficacious and A is more potent than B. So this is what you people have to understand. So in general pharma, one question is expected, and this is the question they will ask you from the DRC. So this is all about this DRC, which they can ask you. Topic number 16 we have covered. So let's move on to topic number 17. So topic number 17, they can ask you the side effects of anti-cancer drugs. So side effects of anti-cancer drug. Recently, they have started asking this anti-cancer drug in FMG exam. I don't know why. Like why these people have started asking this anti-cancer drugs in your exam. So last year, last exam there were three questions. So side effects of anti-cancer drugs. So they can ask you the most common side effects. The most common side effect of anti-cancer drug is nausea and GIT side effects. So GIT side effects, that is nausea, vomiting, and diarrhea. So nausea, vomiting, and diarrhea, right? So nausea, vomiting is a side effect that is maximally caused by cisplatin. Now this nausea, vomiting that is caused by anti-cancer drug is known as chemotherapy-induced nausea, vomiting. We call it chemotherapy-induced nausea, vomiting. Now this vomiting can start within 24 hours, can start after 24 hours. So if this vomiting will start within 24 hours, we call it early vomiting. And if the vomiting will start after 24 hours, this is known as delayed vomiting. Now for early vomiting, you will mark the drug of choice as 5-HT3 blocker. Now all these medicines which are 5-HT3 blocker, they end with the word citron. All these medicines end with the word citron. And for delayed vomiting, you will mark the best medicines as neurokinin 1 receptor blocker. We also call them substance P inhibitor, neurokinin 1 blocker. All these medicines end with the word patent. So the example of citron is ondansetron. So ondansetron is a medicine. This is 5-HT3 blocker. So this is the best medicine for early vomiting. One of the example of medicine that is given for late vomiting is aprepitant. So aprepitant is a medicine. This is the neurokinin 1 receptor blocker. Substance P inhibitor ends with the word patent. Students, make the mnemonic. If you come early for the lecture, you will get seat. If you come late for the lecture, to pitoge. So patent means you will be beaten up, pitoge. So if you come late, to pitoge. If you come early, you will get seat. Now there are very high chances that this time in your exam, this is going to be asked. So this is something which is important here. The medicines like aprepitant or substance P inhibitor. Now the diarrhea caused by anti-cancer drug is non-infective type of diarrhea. So this is the non-infective type of diarrhea, and as a treatment, the best medicine is loperamide. So diarrhea caused by anti-cancer drug is a non-infective type of diarrhea. Loperamide, which is a mu receptor agonist, it's an opioid, it's a drug of choice. In case it is not given, you will mark atropine. So atropine, loperamide can be given for this non-infective diarrhea caused by anti-cancer drugs. Now, the second side effect of anti-cancer drug is bone marrow suppression. So bone marrow suppression, also known as myelosuppression. Now, this bone marrow suppression, myelosuppression, is the most common dose-limiting toxicity. This is the most common dose-limiting toxicity of anti-cancer drug. Like if this side effect will start, you have to stop the medicine. You cannot continue the medicine. You have to stop the drug or you have to reduce the dose of the medicine. Now, this bone marrow suppression maximally affect the WBC. After WBC, this will affect the platelets, and after platelets, it can affect the RBC. So, if you want to increase the WBC count, if you want to increase the WBC count after the anti-cancer treatment, you can give the medicine to a patient. The drug name is filgrastim. So filgrastim is a medicine which is a stimulator of granulocyte. You can see from its name, it's a granulocyte stimulator. This is given to increase the WBC count. Now, if you want to increase the platelet count, you can give the medicine to the patient. The drug name is romiplostim. You can see from its name, it's a stimulator again. You can see filgrastim is a stimulator, romiplostim is a stimulator. Now, this is the stimulator of platelet. So, this is the medicine which is a platelet stimulator. One more example is there is a drug L-trombopag. So, L-trombopag is a medicine which is having a word thrombocyte. L-trombopag is having a medicine name thrombocyte. So thrombocyte is a platelet other name. So we can use this medicine. One more drug is oprelvicin. So oprelvicin is a medicine which is a interleukin 11 analog. You can see from its name, this is a interleukin 11 analog. And interleukin 11 is a natural growth factor. It is a natural growth factor of the platelet. So I can use oprelvicin. So oprelvicin can be given as a natural growth factor of this platelets. So oprelvicin, L-trombopag, romiplostim, these medicines are given to increase the platelet count, and filgrastim is given to increase the WBC count, and the RBC is increased by giving a medicine that is darbepoetin. So darbepoetin is a medicine that is given to increase the RBC count. So these are the medicines that is used with anti-cancer drugs to recover from the bone marrow suppression. Number three side effect of medicine, like these medicines can also result in tumor lysis syndrome. So these anti-cancer drugs can result in tumor lysis syndrome. Now for tumor lysis syndrome, the best treatment is IV fluids. So for tumor lysis syndrome, best treatment is IV fluids. And if the patient KFT has started declining, we can use a medicine that is respiricase. So respiricase is an artificial uricase. This can be used. And if you want to prevent the side effect, along with IV fluids, you can also give allopurinol. So allopurinol can be given, respiricase given for the treatment, but the overall best treatment is IV fluids. So tumor lysis syndrome is the third side effect of anti-cancer drug that we people have covered. Number four side effect of medicine is pulmonary fibrosis. So anti-cancer drugs can cause pulmonary fibrosis as a side effect, and this pulmonary fibrosis very commonly caused by bleomycin busulfan. So this side effect is very commonly caused by busulfan, bleomycin, and methotrexate. So methotrexate, bleomycin, busulfan can cause pulmonary fibrosis, and in order to control this pulmonary fibrosis, we have to give the medicines that will control pulmonary fibrosis. Medicines names are like pirfenidone. So pirfenidone and the medicine is nintedanib. So nintedanib and pirfenidone are the medicines that can be given to prevent pulmonary fibrosis. You can see the medicine name pirfenidone. It is having a word P and F in its name. So pirfenidone is having a word PF. So this is the one that is given for pulmonary fibrosis. And nintedanib is having a word 19. So you can remember like this way. This is given for COVID-19 complication. Nintedanib is given for COVID-19 complication like pulmonary fibrosis. So nintedanib is a medicine that is discovered for COVID-19, but we are using it nowadays to prevent the pulmonary fibrosis caused by anti-cancer drugs. Fifth side effect of medicine is pulmonary fibrosis के बाद the medicines can cause skin pigmentation. So medicines can cause skin pigmentation. The skin pigmentation caused by bleomycin and can also be caused by busulfan. So this side effect is caused by bleomycin, busulfan, and the bleomycin is a drug that will cause skin pigmentation that is in pattern of bacteria flagella. So that is in bacterial flagellate pattern. So this medicine, bleomycin, can cause skin pigmentation that is in bacterial flagellate pattern. Now there is a side effect, we call it hand and foot syndrome. Now hand and foot syndrome is maximally caused by capecitabine. It is maximally caused by capecitabine. In case capecitabine is not given, 5-fluorouracil is the answer. So hand and foot syndrome, which is asked last time in your exam, like which anti-cancer drug can cause hand and foot syndrome? The answer was capecitabine. The second best answer is 5-fluorouracil for hand and foot syndrome. Next is neurotoxicity. So neurotoxicity is a side effect. This is caused by cisplatin. So cisplatin, methotrexate, and vincristine. So cisplatin, methotrexate, vincristine can cause neurotoxicity as a side effect. Now the cardiotoxicity. So cardiotoxicity, guys, maximally caused by doxorubicin. It is maximally caused by doxorubicin, and in order to prevent this cardiotoxicity, we give one medicine along with it that is known as dexrazoxane. So dexrazoxane is a medicine. This is given along with doxorubicin to prevent this side effect, and there are high chances that this question is going to be asked in your exam. So cardiotoxicity maximally caused by dexrazoxane, and this side effect is prevented by doxorubicin will cause the side effect. This is prevented by giving dexrazoxane. Now we have a side effect, hemorrhagic cystitis. So hemorrhagic cystitis is a side effect that is caused by cyclophosphamide. So this is a side effect which is caused by anti-cancer drug cyclophosphamide. Now this side effect is due to, okay, leave the why side effect occurs, leave that thing. So hemorrhagic cystitis is a side effect. This we can prevent by giving a drug mesna. So mesna is a medicine that is given to prevent the side effect hemorrhagic cystitis caused by cyclophosphamide. Now next side effect is the medicine that will cause liver fibrosis. So medicine that will cause liver fibrosis and pulmonary fibrosis both. So there is a drug that will cause liver fibrosis and pulmonary fibrosis both. The drug name is methotrexate. Now if you want to prevent this side effect of methotrexate, you can give one medicine along with methotrexate. The drug name is leucovorin. Now leucovorin is also known as folinic acid. So folinic acid or leucovorin is given along with methotrexate to prevent the side effect. Right? And the last is nephrotoxicity. Now nephrotoxicity is a side effect that is maximally caused by cisplatin. So cisplatin will cause maximum nephrotoxicity. Now in order to prevent this side effect, we can give one medicine along with cisplatin, that is amifostine. So amifostine is a medicine that is given along with cisplatin to prevent this side effect. So amifostine is given along with cisplatin to prevent its side effect. So this is something that is side effects of anti-cancer drugs that can be asked in your exam. So this is topic number 17 that I have covered, the side effects of anti-cancer. Now moving on to topic number 18, they can ask you the indications. They can ask you the indications of anti-cancer drugs. So if we talk about the indications of anti-cancer drugs, so indications of anti-cancer drugs, guys, doxorubicin, methotrexate, and cisplatin. These are the medicines that we use for the treatment of osteosarcoma. So these are the medicines that we can use for osteosarcoma, doxorubicin, methotrexate, and cisplatin. And all these medicines need to be given in high dose. And overall drug of choice for osteosarcoma is doxorubicin. Overall drug of choice for osteosarcoma is doxorubicin. Number two, they can ask you about a drug, mitomycin C. Now, mitomycin C is an anti-cancer drug which has fibrinolytic property. So this medicine has fibrinolytic property. Now, because of its fibrinolytic property, this medicine we can use for tracheobronchial stenosis. We can use this medicine for the treatment of tracheobronchial stenosis. I can also use this medicine after pterygium surgery. I can use this medicine after pterygium surgery. I can use this medicine for tracheobronchial stenosis. The drug name is mitomycin C. Number three, the third indication, they can ask you about a medicine that is imatinib. So imatinib is a medicine. This is ABL BCR tyrosine kinase inhibitor. This is ABL BCR tyrosine kinase inhibitor. This is the drug of choice for CML. Now this medicine is also inhibitor of CKIT. This is also inhibitor of CKIT, and it's also the drug of choice for intestinal stromal tumor. So drug of choice for GIST, drug of choice for CML. The drug name is imatinib. So this is something they have asked you this year in your exam. So this time in your exam, they have asked you imatinib. But the question that is going to be asked this time in your exam, like January 2025, is going to be the trastuzumab. So trastuzumab is a medicine. Trastuzumab is a medicine. This is important for this year exam. This is the drug that is HER2 new inhibitor. This is the medicine that is HER2 new inhibitor. The drug name is trastuzumab. And can any one of you tell me where we use this medicine? So this is the drug that we use for breast cancer. So this is something important for your exam. According to me, this can be asked. Or if you want to know the second thing that is important is this one, the mitomycin C. So these two indications are very high chances that these two indications would be asked this time in your exam. So topic number 18 based on anti-cancer drug indications that we people have covered. Now after this topic of anti-cancer, let's move on to hematology. So in hematology, the next topic is antiplatelets. So we have a topic that is antiplatelet drugs. So in antiplatelet drugs, they can ask you about two medicines. One is aspirin mechanism of action. So they can ask you aspirin mechanism of action. They can ask you about the clopidogrel mechanism of action. And they can ask you about the mechanism of action of FMGE. So these are the three medicines they can ask you in antiplatelet. So aspirin is a medicine that we use in low dose. Aspirin is a medicine that we can use in low dose, 75 to 325 milligram. 75 to 325 milligram. In this low dose, this medicine is COX-1 inhibitor irreversibly. So this is irreversible inhibitor. This is irreversible inhibitor of COX-1 enzyme, that is aspirin. And by inhibiting this enzyme, this is inhibitor of thromboxane A2 synthesis. Inhibitor of thromboxane A2 synthesis. The drug is aspirin used as an antiplatelet. Now we have a medicine clopidogrel. Now this is the ADP receptor inhibitor. Clopidogrel is ADP receptor inhibitor, which is also known as P2Y12 receptor inhibitor. So also known as P2Y12 receptor inhibitor, ADP receptor inhibitor. The drug name is clopidogrel. And the other medicines that belong to this class are prasugrel. We have a medicine like ticagrelor. So ticagrelor, prasugrel, ticlopidine are the other medicines which belong to this class. Now we have a drug efiximab. This is glycoprotein 2B3A inhibitor. This is glycoprotein 2B3A inhibitor. It is given by IV route. So this is the drug that is given by IV route, efiximab, and this is glycoprotein 2B3 inhibitor. So these are the three examples of antiplatelet medicine. If you ask me, sir, इनमें से सबसे important क्या है? So the answer is this drug, ticagrelor. You should be knowing that ticagrelor is a medicine. This is the one that is a reversible P2Y12 inhibitor. Like rest of the medicines of this class are irreversible. So rest of the medicines are irreversible ADP receptor inhibitor. This is the only drug here which is reversible P2Y12 inhibitor. The drug name is ticagrelor. So this is something important for your exam, that is antiplatelets mein ticagrelor is a drug. Now moving on to topic number 20, that is anticoagulants. So the topic is anticoagulant medicines. Now anticoagulants are the medicines. Anticoagulants are the medicines which can be two, can be directly acting, can be indirectly acting. So this can be directly acting, can be indirectly acting. Now the medicines which are directly acting can be inhibitor of factor 10, can be inhibitor of factor 2. So inhibitor of factor 10 or factor 2. Now the medicines which are factor 10 inhibitors, all these medicines are given by oral route, and all these medicines name end with the word XA-ban. So all these medicines name end with the word XA-ban. So we have a medicine like rivaroxaban. We have a medicine like apixaban. So their name ends with the word XA-ban. So XA means factor 10A is going to ban. Now the medicines which are factor 2 inhibitors, these medicines can be given by oral route, can be given by IV route. So the drug that is given by oral route, the drug name is dabigatran. So the drug name is dabigatran. So dabigatran is given by oral route. This is having a word bi in its name, so it's a factor 2 inhibitor, dabigatran. Now we have the medicines which are given by IV route. So the medicines which are given by IV route, medicine name is bivalirudin, and there are many other drugs which end with the word rudin. So one example is bivalirudin having a word bi, ending up with the word rudin. Now rudin is a word that we have derived from hirudin. So hirudin is a scientific name of leech. So these are the medicines which are derived from leech saliva. So we have derived these medicines from leech saliva. So most of these medicines have the word rudin in their name. So rudin is a word that is from the leech, that is hirudin. Now we have the medicines which belong to this class like ergotroben. So we have one more medicine like ergotroben. So ergotroben has a different spellings. Does not end with the word rudin. So you can find out from its name, the medicine name ends with the word thrombin. So thrombin is a other name of factor 2. So factor 2 also known as thrombin. So the medicines will ban the thrombin. So ergotroben is a medicine that ends with the word troben. It will ban the thrombin. So bivalirudin is rudin derived from hirudin, and ergotroben will ban the thrombin. Dabigatran is having a word bi, so it's a factor 2 inhibitors. Now these are the directly acting medicines. Now we have some indirectly acting medicines also. So if we talk about indirectly acting medicines, these medicines can be given by parenteral route. So medicines can be given by parenteral route, medicines can be given by oral route. Now the medicines which are given by parenteral route, examples are like low molecular weight heparin. So example is like low molecular weight heparin. Now here all medicines end with the word parin. All medicines end with the word parin. Example is like enoxaparin, dalteparin. So example is like enoxaparin, dalteparin. That's a low molecular weight heparin. Now medicines that is given by oral route, the medicine name is warfarin. Now apart from warfarin, any drug which is having a word coumarin in its name. So apart from warfarin, any drug which is having a word coumarin in its name. So one of the example is which was asked in your exam around 3 years back, that is dicumarin. So dicumarin is dicumarol. So example is like dicumarol. So dicumarol is an example of a medicine. That's a coumarin group of medicines. Now, low molecular weight heparin is a drug. This medicine will act in plasma. So the mechanism of action in plasma, this will activate one enzyme, that is antithrombin 3 enzyme. This will activate one enzyme known as antithrombin 3 enzyme. And with activity of antithrombin 3 enzyme, this will inhibit factor 10 and factor 2. This is inhibitor of factor 10 and factor 2. Now, warfarin is a medicine. This is inhibitor of an enzyme in liver that is known as vitamin K oxidoreductase enzyme. So this is the one that is inhibitor of vitamin K oxidoreductase enzyme in liver. And by inhibiting vitamin K oxidoreductase enzyme in liver, this will stop the synthesis of clotting factor number 2, 7, 9, and 10. So this will stop the synthesis of clotting factor number 2, 7, 9, and 10. So this will act in liver. Heparin will act in plasma. Now, if we talk about the safety of these medicines in pregnancy, this is safe to use in pregnancy, but this is the medicine that is unsafe in first trimester as well as at the time of delivery. So this is unsafe at the time of delivery as well as in first trimester, but otherwise this is safe in second and third trimester. So warfarin is safe in second and third trimester, but it is warfarin is unsafe in first trimester and at the time of delivery. So what are the guidelines? Like for the guidelines, whenever the female is in first trimester, we can put female on low molecular weight heparin. In second and third trimester, we can put female on warfarin, and at 36 weeks of pregnancy, we can again put female back to the low molecular weight heparin. And the moment the pregnancy becomes 37 weeks, we can deliver the baby. So these are the guidelines to use these medicines in pregnancy. The basic problem with heparin is heparin cannot be given by oral route. Warfarin has a big advantage. It is given by oral route. So the females are not comfortable by subcutaneous route. So first trimester, when the period of safety is a main concern, we keep female on heparin. Second, third trimester, warfarin. 36 weeks pe again heparin, and 37 weeks per delivery. These are the guidelines to use these medicines in pregnancy. Now, how to monitor these medicines? So we talk about the monitoring. Heparin drugs are monitored by partial thromboplastin time, and warfarin drugs are monitored by INR. So the international normalized ratio. Warfarin parameter is international normalized ratio, which is calculated when you divide prothrombin time of patient with the prothrombin time of a standard normal human being. So warfarin monitoring is done by international normalized ratio INR, which is the division of prothrombin time of patient divided by prothrombin time of standard human being, and heparin monitoring is done by partial thromboplastin time. Now, if we talk about the antidotes, so here the antidote is known as protamine sulfate. So here the antidote is known as protamine sulfate, and here the antidote is known as vitamin K1. Here the antidote is known as vitamin K1, and if the patient is bleeding, we can also give fresh frozen plasma. So the patient is bleeding, we can also give fresh frozen plasma. So vitamin K1 is an antidote but having a slow action in the body. Now due to the slow action of the vitamin K1, if the patient is bleeding, we can give fresh frozen plasma to stop the bleeding. So these are the important difference between warfarin and the heparin. So anticoagulants is a second topic that is going to be asked. Like if you ask me, sir, कि इनमें से एक topic बताओ, like what is that one thing that we people have to remember, then I would say you should remember these guidelines. Like the pregnancy में क्या safety है, how to use the medicine is most important here to remember. So most important to remember is these guidelines on this whole topic, right? Now we are moving on to topic number 21. So topic number 21, what they can ask you. So there is a group of medicines, we call them fibrinolytic drugs. So we have fibrinolytic medicines. Now, fibrinolytic medicines, also known as thrombolytic medicines. So, thrombolytic drugs are the medicines which will act like a tissue plasminogen activator. So, these are the medicines that will act like a tissue plasminogen activator. So, these medicines will act like a tissue plasminogen activator. We call them fibrinolytics or thrombolytic medicines. They will act like a tissue plasminogen activator. Now, what they will do? They will activate plasminogen. So, these medicines will activate plasminogen to plasmin. These medicines will activate plasminogen to plasmin. And once they will activate plasminogen to plasmin, they can dissolve the clot. So, these are the medicines which can dissolve the clot. We call them fibrinolytics. And all these medicines end with the word ase. So, these medicines are enzyme. So basically all these medicines are enzymes. Examples are streptokinase. We have an example like tenecteplase. We have an example like alteplase. So streptokinase, alteplase, all these are examples. Now, whenever these medicines are given, there is a risk of toxicity, bleeding can occur. And if they will ask you the antidote of choice is inhibitor of TPA. So medicines promote TPA, antidote inhibit TPA. So the antidote of choice is IACA, that is epsilon amino caproic acid. So epsilon amino caproic acid is an antidote. Second antidote is tranexamic acid. Now this is the very, 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 very important topic for your exam this time. Like what will happen when you give the antidotes? So the answer is when we give the antidote, plasminogen cannot be converted to plasmin. So be careful, guys. The drug promote this action. They convert plasminogen to plasmin, and antidotes inhibit the conversion of plasminogen to plasmin. This is the very important question for this year exam. Especially they will ask you IACA. So IACA is very, very important for your January 2025 exam, and they will ask you the mechanism of action of IACA. So the mechanism of action of IACA is inhibition of the conversion of plasminogen to plasmin. This is something is definitely going to be asked. Topic number 22, they can ask you the treatment of iron overloading. So treatment of iron overloading, guys, this you must be knowing. We have some chelating agents that we can give by IV route. So the chelating agent that is given by IV route is desferoxamine. So desferoxamine is a chelating agent given by IV route. We have some chelating agents that can be given by oral route, like deferasirox, and we have a medicine like deferipon. So deferasirox, deferipon, and desferoxamine are the three medicines. So deferipon, deferasirox, desferoxamine are the medicines. Now, out of these, if you ask me, sir, which is most important? So this is most important. Like oral drugs are more important. So oral drugs for you people have to remember because they have already asked desferoxamine around 3 to 4 times in your group, 3 to 4 times in your exam. So there is a high time that the question will be asked on the oral medicines. This is topic number 22 as per me that can be asked. Now moving on to topic number 23, that is from the autocoids. That is a DMARDs. So DMARDs are the medicines that is given for the treatment of rheumatoid arthritis. So these are the medicines which are given for rheumatoid arthritis. We call them disease modifying anti-rheumatoid drugs. So what is the drug of choice for rheumatoid arthritis? The answer is methotrexate. Now what is the mechanism of action of methotrexate when we use as a DMARD? So this is the medicine which is dihydrofolate reductase enzyme inhibitor. This is the medicine that will inhibit dihydrofolate reductase enzyme. Now, by inhibiting dihydrofolate reductase enzyme, this will stop the synthesis of thymidine monophosphate. And once it will stop the synthesis of thymidine monophosphate, this will inhibit the DNA multiplication or the DNA replication. So this will stop the DNA replication. So this is dihydrofolate reductase enzyme inhibitor, stop the thymidine monophosphate synthesis and stop the DNA replication, and hence WBC cannot multiply. Now this is the medicine that will also increase the level of adenosine, and as a result of adenosine, it has an anti-inflammatory property. So it has an anti-inflammatory property by increasing the level of adenosine. So guys, like if you ask me, sir, इसमें सबसे important क्या है? So last year, like last exam, not the last year, the last exam, they have asked you this question. There are very high chances either they will ask you this, adenosine, or they will ask you this. Like they will ask you, कि methotrexate stop the synthesis of what? So you people already know it's inhibitor of dihydrofolate reductase. But what is the consequence of that? So answer is this will stop the thymidine monophosphate synthesis, stop the DNA replication, stop the WBC multiplication, and medicine has anti-inflammatory property by increasing the adenosine. So this is something going to be asked in your exam. This is most important thing here. The other medicines that we use as a DMARD, medicines names are sulfasalazine. Sulfasalazine, we have a drug hydroxychloroquine sulfate. So sulfasalazine, important side effect is oligospermia. So this medicine, important side effect is oligospermia. Hydroxychloroquine, important side effect is bullseye retinopathy. So important side effect is bullseye retinopathy. So bullseye retinopathy or only retinopathy is a side effect of hydroxychloroquine sulfate. Now we have the medicines like TNF alpha blocker. So TNF alpha blocker medicines names are like adalimumab and etanercept. So etanercept, TNF alpha blocker are the examples of etanercept, adalimumab, TNF alpha blocker. We have the medicines interleukin 6 inhibitor. So the example of interleukin 6 inhibitor is tocilizumab. So tocilizumab interleukin 6 inhibitor. And the last is the medicines which are Janus kinase inhibitor. So the medicine which is Janus kinase inhibitor, the answer is tofacitinib. So tofacitinib, Janus kinase inhibitor, right? So these are the medicines that you should be knowing. Medicines which are DMARDs given for rheumatoid arthritis. This is all about topic number 23 that I think is important. Out of that, the most important is methotrexate mechanism of action. Topic number 24, they can ask you the medicines that we can use for the treatment of gout. So treatment of gout, which medicines we can use for acute attack of arthritis. So medicine that is given for acute attack of arthritis, the drug of choice is NSAIDs. So NSAIDs are the drug of choice for acute attack of arthritis. Like we can use the medicines diclofenac. We can use the medicines like aceclofenac. So diclofenac, aceclofenac are the best medicines for acute attack. Colchicine is a second drug of choice. Colchicine is a second drug of choice for acute attack of arthritis in gout. Now, colchicine is a drug which is inhibitor of microtubular protein. This is the medicine which is inhibitor of microtubular protein. So by inhibiting microtubular protein, this will stop the WBC multiplication. This will stop WBC multiplication as well as this will stop the WBC migration. Stop WBC multiplication, WBC migration at the site of inflammation. At the site of inflammation, this will stop the WBC multiplication and WBC migration. And if you ask me, ki, sir, gout mein, what they will ask? So this is something they will ask you. There are high chances that they will ask you colchicine mechanism of action. So colchicine mechanism of action is important for this year exam. You have to concentrate on this colchicine mechanism of action. Third is steroids. Now, which medicines we can use for maintenance treatment? So the medicines that is given for maintenance treatment, the medicines which are uric acid synthesis inhibitors. Medicines that will stop the uric acid synthesis by inhibiting one enzyme, that is xanthine oxidase enzyme. So medicines inhibit xanthine oxidase enzyme, like medicines we have allopurinol. So we have a drug like allopurinol and febuxostat. So allopurinol, febuxostat are the example. Now we have the medicines that will increase uric acid elimination from the body. So uric acid elimination medicines that will increase are known as losartan and the probenecid. So probenecid and losartan will increase the uric acid elimination. Now number 3, the medicine that will increase uric acid metabolism. So medicines that will increase uric acid metabolism in the body. So these medicines end with the word case. So these medicines examples are like P-gluticase. So basically these are the artificial uricase enzyme. So these are the uricase enzymes. So they end with the word case. So we have a P-gluticase. We have a medicine like resp-uricase. So P-gluticase, resp-uricase are the examples of the medicine which can increase uric acid metabolism in the body. So this is the topic number 24 which can be asked. Topic number 25, they can ask you the side effects of ergot derivatives. So we have some medicines which are known as ergot derivatives. So examples are like ergotamine. Example is like ergotamine. So ergotamine is an ergot derivative. This medicine will act on serotonin 1B and 1D receptor. Medicines will act on serotonin 1B and 1D receptor. And by acting on this receptor, these medicines can cause cerebral vasoconstriction. And these medicines can relieve the pain. These medicines can relieve the pain of migraine. The same mechanism is seen with triptans. Triptans also act by the same mechanism. So both triptan and the ergot derivatives, they have an important side effect as vasoconstriction. As a result of vasoconstriction, these medicines can increase the blood pressure, can cause myocardial infarction, can cause angina, can cause peripheral vascular disease. So both ergot derivatives and tryptophan, they are the stimulator of this receptor 5-HT1B1D receptor, can increase blood pressure, can cause MI, angina, and peripheral vascular disease. But apart from that, ergot derivatives can also result in fibrosis. So they can result in multiple types of fibrosis like retroperitoneal fibrosis. And these medicines can also damage heart valves. These medicines can also damage heart valves. So last time in your exam, they asked you this question. The patient has taken a drug and patient heart disease has been precipitated. So which drug patient has taken? So the answer was tryptophan has caused this side effect. But there is high chances that this time they will ask you which medicines can damage the heart valves. So the ergot derivatives can damage the heart valves. Yes, Dr. Dipti has said that ergot derivatives can also cause fibrosis in lungs. So we call it pulmonary fibrosis. Yes, pulmonary fibrosis, retroperitoneal fibrosis, cardiac fibrosis. So everywhere they can cause fibrosis. But the very important point is they can damage our heart valves. So ergot derivatives, topic number 25, according to me, is important. Now, after discussing all these things, uh, topic number 26 is from GIT, that is prokinetics. So medicines which are prokinetics, so they can ask you the prokinetics. Now, prokinetics are the medicines which we can use for GERD. So these medicines which are prokinetics, they can increase the peristalsis. And by increasing the peristalsis, these medicines are given for the treatment of GERD. Which are these medicines? So this is very important. They are the dopamine 2 receptor blocker. Medicines are dopamine 2 receptor blocker. And the medicines which belong to this class are metoclopramide. Medicines are metoclopramide and domperidone. So dopamine 2 receptor blocker. Now out of that, metoclopramide can cross blood-brain barrier. So after crossing blood-brain barrier, this medicine can block the dopamine pathway in CNS, can cause Parkinson's-like symptoms, like extrapyramidal symptoms, can result in muscle dystonia. So result in muscle dystonia, result in extrapyramidal symptoms, that is metoclopramide. So metoclopramide can cause this symptom, and there is a very high chance that this question is going to be asked this time in your exam, because these medicines are also used as antiemetics. So they are not only used as prokinetics to increase the peristalsis, they can also be used as an antiemetic. So there are very high chance that this time they will ask you which antiemetic can cause muscle dystonia, or which medicine of GERD, that is a prokinetic, can cause this side effect. Second medicines are serotonin 4 receptor agonist. So medicines that will directly act on serotonin 4 receptors, and they will also increase the peristalsis. Now all these medicines end with the word pride. One of the example is cisapride. So cisapride is a medicine. Important side effect of medicine is QT prolongation. Number 3, we have a medicines which will act on motilin receptor. Medicine that will act on motilin receptor, increase the peristalsis. This is erythromycin. So this is the topic, we call it prokinetics, that is given to increase the peristalsis in GERD. The most important thing they will ask you is the side effect of metoclopramide, that is muscle dystonia. So question number 26, answer is, the question number, topic number 26. Now my brain is getting down after 11 p.m., right? So muscle dystonia is a important side effect of metoclopramide. So let's wind up this session, guys. 26 ho gaya. 27th topic number 27. They can ask you antiemetics. Topic number 27 important for you is antiemetics. And in antiemetics, they will ask you mainly the chemotherapy induced nausea vomiting that we have also already covered in topic of anti-cancer. They can ask you the best medicine for morning sickness. They will ask you the best medicines for morning sickness. So for morning sickness, we give doxylamine plus vitamin B6 combination. Doxylamine plus vitamin B6 combination they can uh, give. Now they can ask you what is the best medicine for motion sickness. Now for motion sickness, you will mark best medicine as hyoscine. If it is not given, you can mark promethazine. So hyoscine, promethazine. And which is the best medicine for mountain sickness? So the best medicine for mountain sickness is acetazolamide. So best medicine for mountain sickness is acetazolamide. So mountain sickness, acetazolamide, motion sickness, hyoscine, morning sickness, doxylamine, and chemotherapy induced nausea vomiting we have already covered in topic of uh, cancer, where I told you that aprepitant, which is neurokinin 1 receptor blocker, has a maximum chance to be asked. Very high chances that this is going to be asked this time in your exam. Topic number 28. Now I'll just write down the topics because uh, all topics are difficult to cover. So, like topic number 28 that you can read is drugs for bronchial asthma. So, drugs for bronchial asthma is important topic. So, drugs for bronchial asthma, you should mainly read about the treatment of status asthmaticus. So, treatment of status asthmaticus is important. So, this is something that you people can read, drugs for bronchial asthma. Topic number 29 that you people can read is cholinergic drugs. So cholinergic drugs are important. Like they can ask you about these medicines like neostigmine. So neostigmine, pyridostigmine. So pyridostigmine given as a drug of choice for myasthenia gravis. Neostigmine is used as a drug of choice for reversal of skeletal muscle relaxant asked last in your exam. So these drugs I'm not able to cover properly. So I'm just telling you to cover by yourself. So neostigmine, pyridostigmine, donepezil. So donepezil, rivastigmine. So these are the some important drugs in cholinergic topic. One more is pilocarpine. So that you people have to read in cholinergic topic, right? Topic number 13, which I think is important for you, is alpha blockers. So in alpha blockers, you have to mainly concentrate on two medicine. One is prazosin, one is tamsulosin. So guys, tamsulosin is a drug of choice for BPH. Tamsulosin is a drug of choice for BPH. So this is also very important topic. The topic is alpha blocker. Topic number 21, anti-glaucoma drug. So anti-glaucoma drug is also very important topic, especially the side effects of the medicines. Side effects of medicines. Topic number 32, diuretics. Diuretics that act on PCT of kidney. So diuretics that will act on PCT of kidney, we call them carbonic anhydrase inhibitors. Medicines are SGLT2 inhibitors that we covered in diabetes also. And the third is mannitol. So mannitol is the third medicine that will act on PCT of kidney. This is important. Topic number 33, antihypertensive drugs. So antihypertensive drug with special mention on AC inhibitor ARBs. Special mention on AC inhibitor ARBs and the calcium channel blockers. This is important. Last is drugs for congestive heart failure. So drugs for congestive heart failure also important for your exam. One more, ACLS algorithms. So ACLS algorithms you people will cover in your anesthesia class also. So in anesthesia class, you will cover about ACLS algorithm. So these are the other five topics which you should concentrate more. So I have tried to cover as much as possible. So up till 27, I have covered 7 topics I am giving you as a homework that you people can read by yourself because these are the topics which I have covered so many times in my revision class also. Like when we had our face-to-face class, we give maximum time to these topics. So I think you are comfortable with this topic and with this assumption that you will do well in your exam. And with like I'm also wishing from the God that whatever things we have discussed today, we wish ki the same things will be asked in your exam. And I also wish ki the same things you people will able to recall in the exam, right? So guys, thanks for listening to me for last 20 for last 2 hours 15 minutes. And in case you want to join my Telegram group, you can join. So Pharmacology by Dr. Saurabh Bhatia, right? So this is my Telegram group in case you want to join. So guys, with this, I wish you all the best for the exam. I know that there are very few days left, but still you can do well and you definitely come up with the flying colors. My all wishes are with you. Keep calm, keep your nerves under control. Don't panic. You have done well, you have prepared well. Everything is going to be good. Take care of yourself, guys. Good night. Shabba khair.